The first one I want to talk about is a discovery application of the global panel. And these largely reflect plasma profiling. So in large population studies, the most attractive sample type to get is either plasma or serum. Urine reflects another popular matrix, but it's not homeostatically maintained the way plasma or serum are. So a lot of the things I'll talk about are in the focus of plasma and serum and capturing signals in the circulation to understand complex disease. So working with Claudia Langenberg at Queen's Mary University in London, she asked a question from her EPIC cohort, so profiling 12,000 EPIC Norfolk patients or subjects to understand metabolic signatures of simultaneously existing chronic disease conditions called multimorbidities. So 25% of subjects, now patients, are presenting at clinics with multiple chronic conditions. And it's reflected a challenge or created a challenge in the health community to treat, how do you treat someone who's presenting with multiple chronic conditions and which ones do you treat? The focus of the study was to understand what the metabolic signatures are for distinct chronic conditions and an aggregate for people with simultaneously multimorbidities, and to understand those signatures. So on the left there, an odds ratio of 95% confidence intervals from logistic regression analysis was performed, and then the metabolite disease associations were ordered by strength of association and directionality. And what emerges from that graph on the left is that when you zoom in, as we're zooming in here for the purpose of making the point on what the metabolites are that are strongly associated, meaning they are associated with poor outcomes, or negatively inversely associated with better outcomes, that on the right, the negatively associated or associated with poor outcomes tend to be enriched in glycerophospholipids. And then when you look at the category on the right in blue, that these metabolites tend to be focused or enriched on microbially derived compounds. And it starts to identify what classes of metabolites, what pathways, what signatures are associated with poor outcomes. Could they be drivers? Could they be diagnostic? And which ones could have good outcomes? And one of the interesting things that emerged from the study is that 2/3 of the associated metabolites detected in the study, 2/3 were associated with multiple chronic conditions, whereas only 1/3 was associated with one chronic condition alone. And what that means is that there are shared etiologies to multiple chronic conditions that perhaps suggest that there could be opportunities for interventions, or at least diagnostics, to identify who's at risk for multiple chronic disease conditions. You can improve all chronic disease conditions if you can identify a shared metabolic perturbation and improve the lives really quickly in a really sad cohort with poor outcomes that have really significant health challenges. And then you also have the opportunity from the metabolites that are significant or specific for one multimorbidity or one disease only, to have therapeutic opportunities for those as well, diagnostic and therapeutic opportunities as well. And when you expand the aperture on the right and look across all the multimorbidities, and this is looking at a mirrored Manhattan plot, looking at the p-values. These are all, of course, surviving Bonferroni correction or multiple testing, that the metabolites on the top half of that graph, that image, are positively associated with those multimorbidities across all the diseases. And on the bottom part, it's the negative associations or inverse associations. And I know it's more of an eye chart, but I want you to kind of get the scatter of all the lines across all the diseases, that there are very potent signals. There's very potent metabolic perturbations that are happening in these disease states that are both positively associated with poor outcomes and inversely associated with poor outcomes. Interesting, cancers in the middle tended to be a little more quiet, with the exception of lung and colon cancers. And this tends to be because these were not well represented in the study. So it was a power question for the cancers, that in this specific cohort, there just weren't a lot of the specific cancer types that drove a high power to be able to identify this analysis. But I think it's an area for fertile investigation.